Health is a big issue, isn't it, with all of us around the world. It doesn't matter where you are, whether you're living here in the United Kingdom with our splendid National Health Service, or indeed any part of the world where you have to pay for your health care. I mean, we all pay in one form or another, don't we? I don't know about you, but I think we've all worked out the fact that when a doctor or, you know, whoever they are, a GP, general practitioner, recommends anything for you, it's normally because, you know, they're in sync, or their practice is in sync with someone who's pushing that particular drug that month. You know, they don't think we've worked all of that out, do they? So it's interesting to note exactly how the health service is currently developing over here in the United Kingdom. And as ever, let me explain. Hi, good morning, Neil Sean here in the very heart of London. Thank you for joining me today, and as ever, thank you so much for all of your kind comments about that recent video regarding the fake news. That's right, yes. Interesting, wasn't it, when you see exactly how they fake things up to make them look exactly like they're caught in the moment, you know? Terrible situation, really. I don't understand why people just can't be more transparent. You know, really, that was the point of starting up this channel, to tell you what I find out, share it with you, and then of course we get an honest and, you know, vibrant at times debate, but at least it's out there, you know, rather than being covered up because, you know, you've got somebody who, again, you know, it just make me laugh. The other day I switched on the TV and there were two multi-millionaire presenters on breakfast television telling us how to put tin foil behind the radiator. You know, I mean, it's ridiculous, you know. You kind of think, find somebody else that's a little bit more relatable, connectable. Back as ever though to your breaking story of the day. This really all centres upon the biggest problem that we have right now here in the United Kingdom, the refugee migrant crisis. Also, we can tell you that one of the big hotels down in Cornwall in Devon, it's a big castle down there called Camelot. Very exclusive place that if you can afford it, you know, you could have a wonderful wedding there. You know, it's a beautiful spot, a wonderful part of our country. Absolutely. Well, they refuse to be requisitioned back as a refugee hotel. Many of them have been, but not this one. They're now kicking back saying no because they feel it will damage their reputation, and more importantly, moving forward, I believe, obviously, you know, the damage that could take place by some of these, shall we say, guests staying, and I mean that nicely. But here's the story that I found out for you, and it's incredible when you think. You know, the option where you say, I'd like to go and see the doctor, and you now go to the practice and they say, there's no appointments till this date or that time, and now you've got to tell the receptionist exactly what's wrong with you. What about patient confidentiality? Where did that go? Suddenly you can tell anybody on the desk apparently what's wrong with you, and they decide whether you can see a doctor or not. Well, a lot of doctors have gone missing, and that's because they're disappearing from their practices because they've got contracts to go out to the refugee hotels at least twice a week for up to 4 hours at a time. That's right. So these refugees get to see the doctor before you, the paying taxpayer. Nothing wrong with that, some people might say. However, when you also factor in the fact that we're going through a cost of living crisis, and of course a lot of people can't afford to heat their homes, you've also got the fact that many of these people are living in 3- and 4-star hotels. On top of that, they get £40 a week, 3 meals a day, free Wi-Fi, free mobiles, and the opportunity to go in and out from the hotel where they can sign in or out, but they're not going to be tracked. Unbelievable when you think about it. Crisis over here in the NHS. Seemingly a lot of the GPs don't want to do the job that they're paid to do, but more importantly, wish to make extra money outside of their normal hours of a GP by making many visits to these refugee hotels in and around their own areas. Fascinating stuff, an investigation that we're going to keep looking at from time to time to update you. But as ever, I'd love to know what you think to this particular story in the comments below. Neil Sean in the very heart of London.